Welcome to the Global Health Catalyst series, and my name is Vivian Kopsinger-Birchall, your host. My special guest is Dr. Hricak, the chair for the Cancer Moonshot Commission. And I think I said that right, correct?
Yes, you did.
Welcome to the show.
Thank you very much for asking.
To the benefit of our viewers, can you tell us about you and what you do and your role with the Cancer Moonshot?
Oh, sure. I am a diagnostic radiologist, and the first Lancet Commission that I was chairing was a Lancet Commission on Imaging and Nuclear Medicine. Provided excellent data on the impact that improving infrastructure can have on patient outcome, as well as return on investment. Became very involved with Lancet commissions. We just sent in the Lancet Commission on radiation therapy and theranostics. Since I am a radiologist, theranostics is a part of what we do. And now I have a privilege of co-chairing the Lancet Commission Cancer Moonshot 2, which really is going to examine the global workforce shortage and propose solutions how to move forward. While we are definitely going to talk a lot about technology, innovation, and AI, because without that, we cannot move forward. But behind all of the machines that you can buy, all of the drugs you can give, has to be a workforce, has to be a healthcare provider. So that's why we are looking what are the gaps and how to address that. Is it going to be education and training? Is it going to be methods for retention? Because there is a tremendous brain drain from Africa. What changes are needed to provide for every person in Africa really equitable cancer care?
There is a lot that I could ask from that introduction, but first let me start with AI. You've talked about technology and AI. When we're talking about bridging disparities, especially through AI, we know that AI is coming with its biases because of the machine learning process, where in that the people training these machines might not necessarily be from the region of Africa. And with AI technology, what you put in is what comes out. So as you're working and exploring using AI, building AI models and using AI, what are some of the strategies or the vision for making sure that these AI biases are addressed?
You are so very right. And we have already seen AI biases in other areas, not just healthcare. So absolutely correct. And this is why one of the proposals will be that generative AI and how you teach AI. It's just you can look at generative AI as a young doctor. How you teach them, that's how they're going to behave. So we are going to propose that somehow we have to find a way to partner with big companies, either Microsoft, Google, Amazon, that are really investing heavily in AI. But it has to be developed country specific. It has to practice personal or precision medicine. One should, it cannot be one for all. We are all different. So it has to, the training of the AI, just like you said, is equally important as then what to expect from AI and as training of the humans.
Right, and then again, similar to AI, because I'm emphasizing on that because it's the future, really.
Absolutely.
Is one of the biggest concerns also is the bad actors when it comes with generative AI specifically, and when it comes to healthcare, bad actors could result to a loss of lives. So, as we are exploring again the adoption for AI in treatments, what do you hope will be some of the mitigation measures to make sure that there is a lot of security when it comes to using AI technology? And because one of of course, the solutions that, not solutions, but the best practices is to make sure there is a human in the loop.
Well, yeah, first of all, there are bad doctors as well. So there is bad in not only doctors, in every profession that you go, right? So as you're going to train, we have to really pay attention what the team that's going to train AI. That's one. Second, just like each and every of us, that generative AI will learn more every day and will become better and better every day. So I think we should be, just as you said, very cautious how to design the entry point, how to teach, and also how to supervise. It's not that, you have to, I always say delegate, but supervise. Make sure you know what's going on. But you have to be very precise at every step. And you really have to, we learned that in some other technologies, too late, how you have to be cautious that we are all different, and just as we aim to practice precision oncology or precision, we have to do the same strategy to look for the precision generative AI.
Right.
And also, when that tool has to be specifically developed for the environment. But as it is in the environment, it's going to get better and better every day.
Right.
I am not afraid that AI is going to take over. You always will have, especially in cancer care, you always need somebody to touch your hand, to look you in the eyes and say it's going to be okay. But behind the curtain, getting all that information, then I can then present to you in a factual and data-driven way. That's what we need. And that's what AI, now people do say that one day maybe robots is going to sit like this with you, but I think that's far-fetched.
Right.
For the next 5-10 years, we really need AI to augment our work. We need AI to give us efficiency and streamline, and to really help us putting all those data together.
Right, which is great. One of the concerns I also have with AI and is it's how the energy that it uses, power that is needed to even generate one image is a lot. But when we're looking at African countries, they are struggling with energy. And we're trying to transition to energy efficient, everything, but we also know that one of the biggest emitters is hospitals.
Absolutely, healthcare. Globally,
globally, yes.
Yeah. And no question. But there are now many measures that we are fully. People don't realize that the the contamination of the environment by healthcare, which is huge. And since I work in radiology, consumption from CT scanners, from MRI, from angio equipment, from PET CT, from radiation oncology, it keeps adding up. But we are really, really very conscious of that. There are a number of measures that already have been implemented from industry as well. Well, I like to say that it was led by academia. Industry is a wonderful partner, and they are putting a lot of measures in to really decrease this consumption of energy.
Right. So if I take us back to the workforce development and technology, what are some of the strategies that you envision? It might not even be an existing strategy, but a vision for building this workforce in Africa, for example, in the area of even if it's AI and other technological platforms to bridge these disparities in cancer. What is that vision?
So, we don't have the answers. And I don't think we'll ever have all the answers. But one thing that is now so very different, and that actually COVID greatly helped, and that is that we all are now comfortable with Zoom. We are all comfortable with virtual presentation and virtual education, or exactly what the Global Health Catalyst is doing, the School. That is fantastic. Where you can, and we're already doing that, where the residents can access, and physicians and anybody, but for teaching, for education, we always talk about younger generation, can access our multidisciplinary board, access our regular teaching conferences in many, many universities and places in the United States. The only thing I would like to say right now, somehow we have to have that organized, better organized, because right now, very often, when you have a hospital or university in Africa where the leaders have connection to Harvard or to Penn, that's how the collaboration started. But not every leader has those connections. So we really need to make an effort to unite, almost like have a policy or have a global, not fund, but depository where you can just say, I would like more education in hepatobiliary cancers.
Right.
And then catalog and will tell you where you can then log in and do. So there's a lot of work that needs to be done. But IT, Zoom, virtual technology has opened the doors and the windows that we never, even 5 years ago, would never dream about. And today is a reality.
Right. And I like to consider myself a patient advocate for for lack of a better words, in some cases. But when we're looking at technology, especially when it's new in an environment in sub-Saharan Africa, one of the things that it could easily be lost is a patient's privacy, or patient's, I can't think of the right word, but as we're looking at ways to intervene and create these very specific interventions for these communities, has that conversation been, is it part of your work to make sure that whatever technologies are developed or built for these communities, that they will still maintain privacy of the patient?
No, you have to, and it's a patient privacy, but it's a culture. You have to understand local cultures. What works, because I live in New York, what okay in New York may not be okay in Ghana. And you absolutely have to understand that and respect other cultures, and also you always have to involve local people to help you. You cannot I cannot tell you what to do. It has to be your own group, your own culture, your own people. That's a ABC of successful innovations and development. And we have many examples in the past where people think they can tell somebody 15,000 miles away what to do. No, you cannot even tell them. No. Has to be respect culture, respect people you're dealing with. It's extremely important. And listen. Listen and then design something that would fit them. Because if it doesn't fit, if it doesn't gel, it will never be used.
Right. If I were to ask, what are the 3 top issues you've learned about Africa from being on this commission? And after telling us what you've learned, what are some of the next steps you envision the commission is going to take?
So, once upon a time, probably about 50 years ago, I don't know if you know, but Africa was actually epicenter of cancer research. We looked at Africa for the development of new drugs. Unfortunately, due to all the political uprising and too many wars, and it really disappeared. Now Africa is waking up again. And unlike 5 years ago, where we would all do things for Africa, now Africa is doing things for themselves. They are much more active. They are energized. They even with all the difficulties, and many of them have a number of problems, they still that willingness to move forward, to have energy, and to create a better tomorrow. And that is different now than it was 5-10 years ago. And I think that is absolutely wonderful. Because yes, we meaning from outside Africa, can help. But it will be valuable only when we do it together, more than collaborate, when you lead as well. So we are equal partners in this new world of innovations and solving the problems of the workforce.
Right, and in terms of the next steps, what are some of the next steps for the Commission?
Well, our biggest problem by far, is getting data. You don't have registries. You do have, but it's not uniform, it's part. Some countries do, some don't. There is no national cancer policy everywhere, and very often, even if the country has national cancer policy, it sits on the shelf and it's not being applied, so we don't have data. And another thing, healthcare has changed. A big part in cancer care really now has shifted to primary care and community workers. Maybe it's us that finally realize that that is really the core of the healthcare workforce for cancer, to really bring patients in. And there are no registries. For primary care, yes, but for community workers, for all the ancillary people that help and that are essential in healthcare, because we need to know what we need to develop. It's relatively easy with physicians because we can get physicians' numbers and data. It is more difficult with nursing. And then the more you go along the chain, the more difficult it gets. Because who do you turn to get your data? So we need to really educate the government, health ministry and policymakers, so there are registrations, so we can get the data.
Is it because the governments don't know and need education, or because they don't have the tools to build those registries?
Probably it's an element of both, but I really think it's a lack of awareness. for which both you and I are guilty, that we didn't take time or we don't. Part of it is its lack of education. Now, it's not education, it's just understanding what's needed because they have so much to do.
Right. But, part of I just finished my research on cancer in Uganda for my master's at Harvard Medical School. And I got to learn that some of the government, they know what is needed. They're just not able to implement some of it. And especially at the grassroots, say community health workers and health centers. For example, if a country has a 4% GDP going towards health, and that's not unique to Uganda, it's Ethiopia, it's Tanzania, it's different countries, they have to ration that
priorities, right?
And then some of the registries, they are there, but archaic, they're using paper. And it's so hard to track with paper.
See, you need IT.
Exactly. And when you need IT, you have to build an ecosystem to support that,
Yeah.
like how to maintain the machines, how to give connectivity, Wi-Fi in the whole region. So, as a commission, are you taking some of the steps to look at the whole ecosystem to build technology? Because technology is broad. It can't just serve, for example, just putting in data. It's how can that data be used by the healthcare workers and patients alike?
Right. No, we are not going in those details.
Okay.
Absolutely needed, but you have to stay focused.
Right. So what's
And
the focus?
we will, some of the points that you just raised, will definitely discuss and recommend that something it has to be looked at in a systematic, not, that you said they know, but they don't have resource, and I'm sure that's correct, but not everybody knows.
Sure.
And so you need both, and we will put this in the discussion. Food for thought, so people know what else is missing. But we will focus on the workforce development, which is a lot, which means, first of all, you need benchmarks. And that's where we are right now struggling with the benchmarks and the numbers. Then after you have benchmarks, you really need to find gaps. And you have to always look at the low-lying fruit. What would be the best, what would give the best improvement, and then go up the ladder. But there's a lot that needs to be done.
Right, and then finally, we are at the Global Health Catalyst Summit. What do you see, how do you see the relationship between the GHC and this commission in terms of addressing the challenges that Africa is facing?
Well, all the leaders of your GFC are on the commission, so that's your best connection. They'll make sure we address the right thing, and then they'll make sure that's, because it's not just having a manuscript or having a commission. The biggest part, after that, the work starts, and that is dissemination and implementation. And since we have Will, Stefan, we have all of them on, so I think they'll be able, a big part of the authors from the Africa Commission, Sub-Saharan Africa, are part of this commission. And it was done on purpose.
Well, with that, is there anything we haven't talked about that you'd like to tell our viewers?
I just want to say I am not an expert in AI. I don't know how I got involved in all of this, but I believe in. I am a computer nerd. Because of radiology is very much technology driven. But just so nobody gets, if anything I said wrong about AI, it's my personal opinion.
No, thank you. I like to say there's never a wrong answer. It's just a different perspective. But with that, I would like to say thank you for being, first of all, the chair of the commission, for the wonderful work that you and the commission are doing or the co-chair, I should correct that.
Yes.
And your passion to making a difference. We really appreciate that.
Oh, you're so welcome. It's
Yeah,
really,
it's
we will succeed.
Absolutely. We have no choice but to succeed.
And that's what I say.
And to our viewers, thank you for watching this episode of Global Health Series. Till next time.
Thank you.